Hello. We are going to go ahead and get Direct Summit kicked off again after lunch. We'll wait for people to come on in and take a seat. Hi, everyone.
Hello.
How's everyone doing?
Good.
Very good. I'm Dylan Winspear. I'm the head of product design here at Awardco. And before I get started, I want to take a moment and just give a quick recognition, as we do in the Awardco spirit, to all the presenters who've already presented to us today already, the content that they prepared, battling through the nerves that I'm sure exist, but the content that they've prepared has been fantastic, and we're just grateful for everyone and their participation. So how about a quick round of applause for everyone who's presented so far? That's awesome. By a raise of hands, how many of you have watched, either live or afterwards, one of our ACQ events? Okay, so I'm going to introduce myself. I'm Dylan Winspear, and you would have seen me in some of the ACQ events. This is going to be my shameless plug that every quarter we have an event that we call the Awardco Culture Quarterly. And we have guests and interviews, panels, but we also have a fun segment that we do all about our product announcements. We talk about roadmap, the fun things that are coming out, and what we're doing. So a plug to check out the next ACQ, and you're going to hear even more. Today we've only got 45 minutes to cover a quick product portion, so if you want to hear more, there are ways that you can get involved and get those details, ACQ being one of them. And the Awardco Minute. How many of you check out the Awardco Minute when that gets emailed out to you? Awesome. Another plug, a lot of effort going into those items just to make sure we communicate as much as we can. We don't get as much touch points with you as we would like. And so those touch points with ACQ, the Awardco Minute, even our product board. If you're not familiar with product board, you can talk to your CSM. Product board gives you a little bit of insight into all the different features that we're working on. Great way to give feedback and kind of get involved in the direction that we're heading. Okay, so I think with that, I've covered all my quick announcements, I think. Have anything else? I think I covered that one. Okay, we're going to go ahead and get started. So with this product segment, we get the opportunity to just, real briefly share something with you guys. And as we've been going through that process of what would be appropriate to share with this healthcare group, it was a clear, obvious, cherry-picked winner. I am excited that I get to introduce to you our two product experts that will be coming on the stage and presenting to you. Our principal UX designer, Brett Bertola, and product manager, Chelsea Clement. Come on stage. And these are our experts, part of our recognition team, one of our recognition teams here at Awardco. They're mic'd up and ready to speak. We've got a couple engagement questions that we're going to be kind of going around and discussing. So you guys familiar with the blue cube? Okay, so we know how this cube works. It is being recorded as well, so that if you've got a comment we can share, you speak into this fun blue cube mic, and we'll make sure it all gets recorded. So you'll see me bouncing around, looking for some feedback or people who are willing to share some stories. But without further ado, I think we give a round of applause and hand it over to Brett and Chelsea. Let's go ahead.
Thanks, Dylan. A little bit further introduction. I'm Chelsea. I've been at Awardco for about 5.5 years now. I'm an avid reader. My partner likes to make fun of me, saying that if I read through all of my books, it would take me 3 lifetimes to read all of my books that I have, and I keep buying more books. So it's a problem. I recently had a birthday, and I spent probably a few $100s on books. Brett.
My name is Brett Bertola. I'm one of the designers here on the product team. And fun fact, me and my wife have been going to get ice cream together every Tuesday night for 10 years now. It's how we met. We got married on Tuesday, so ice cream is my favorite thing.
So today's Tuesday, so if anyone wants to go out and get ice cream,
we'll
Brett's
be going out
tonight.
tonight for ice cream.
What's your favorite flavor?
I don't know if Handel's is, I think it's a chain, I don't know if it's just Utah, but Handel's Oreo is my favorite.
Nice.
So, while you're in town.
So like Dylan mentioned, this is going to be a little bit more interactive. We want you to discuss with your table, share some stories with us. There's going to be a little survey each of your placeholders. If you don't have one, just raise your hand. We can get one to you. Fill that out as we're going through this presentation. We're going to collect it afterwards. Take a look at your feedback, take a look at your notes, and review those. So let's go ahead and get into this. I want to first start off with a story. This is my friend Jessica. I've known her for about 10 years now. when I met Jessica, she's always said, I want to live a life that is fulfilling. I want to make a difference in the world. So she had a career working for the Paul Mitchell Hair School, where she was working in administration. She thought that was a really great job, helping students fulfill their dreams of becoming cosmetologists. But after a while, she just wasn't sure if this was the right career path for her. And so she took a look at some of our friends and the things that were going on. She decided to pivot into nursing. And she thought this would be a really great way to make a difference. She felt really passionate about nursing. But she got into school, going into her clinicals, and she confessed to me, she's like, being a nurse is hard. It's so much harder than I expected it to be. She quoted and said, nursing brings out all sorts of emotions your way. Madeline talked about this earlier. There's the highest of highs, the lowest of lows, and Jessica was going through that. She didn't realize how it really played on your emotions. And there's times that she even confessed to me. She's like, I don't know if this is something I can do. Even I'm still in school and this is so hard. What's it gonna be like when I'm doing this full time? I'm doing these long shifts back to back. I'm never gonna see my husband. How can I make a difference? How can I actually do this career? So just before she went on a trip, she received this recognition from a patient. So to read it out, it might be hard to see. It says, Jessica the nurse was incredible. She went out of her way to make my husband and myself comfortable. She was always checking in, beautiful smile and heart. You can tell she loves her job. So she got that just before she went on vacation, and she's like, you know what, I am making a difference. This patient went out of their way to say that I made a difference in her and her husband's experience. It's like, I didn't feel like I was making an impact, but it really was. And what's really cool is she actually went on to be nominated and received a Daisy Award from one of her patients. So she thought that was really cool, and it was a pivotal moment for her. She realized, I can do this. This is something that I can make a difference in. I am in the career path that I need to be in. I'm gonna keep going with this. And when I asked Jessica about her stories and if I could share them today, this is what she said. She said, I love what I do. I love my patients. I love taking care of them. I love holding their hand and talking with them at 2 in the morning. I feel so fulfilled. I'm glad that I made the decision to leave my previous career. So because of the recognition she received, it validated her, and she knows that she is now in the right career path. It's been several years since she's graduated school. She's very excited with what she's doing. So this is when we're getting a little bit more active. That was a wow experience that she had received. Amongst your tables, talk about stories. Just for a couple minutes, what stories of recognition stand out to you that you've heard within your organization? We'll give you a couple minutes and then we'll regroup. Yeah, cool. So Dylan's gonna walk around with our cube. He also has some swag vouchers for you. Does anybody have an experience that stands out to them, of recognition that may have happened to you or someone in your organization that, obviously there's some murmuring, some came to mind?
I'll share mine, yeah. That cube was right there. You took it more than throw.
Do you want to try and toss it? We can do it. I'm not afraid.
Next one's gotta be somebody in there. I have a story though.
You mind sharing?
The cube says, do not throw it at heads. Just a disclaimer.
I was telling them we had a nurse. I work for an organization that does health screenings, National Kidney Foundation, and we recruit nurses from the nursing schools that work these events. So we come in and do consults, and then we secretly sort of recruit nurses. So we hired a nurse from one of those nursing schools, or we recruited one. 6 months later, she comes to join us. A month later, I hear that we had a deaf patient in one of our offices, and she knows sign language. And so she provides sign language to work with that physician to provide that consult.
That's awesome.
And we used our Awardco platform, obviously, to share that with everyone and recognize her. So.
Yeah.
Very cool.
I bet that meant, yeah, let's give out some.
I've actually got some really fun cards here, but I think the random drawing is going to make it more fun.
Okay,
so you get to go again here.
Okay, all right.
What we get?
Let's see. Water bottle.
Water bottle. There it is. Cool.
Okay. Any other stories that you guys have come to mind? Could be something quick, could be, oh, yeah.
I know I'm supposed to throw this, but I still feel weird doing it.
I'm Danny Kurtz from Intermountain Health.
Thank you.
I used to be on the patient experience team, and now I'm on the caregiver experience team. And we want to be very intentional about connecting. I really resonated with Madeline's discussion about the power of reconnecting people to purpose and fanning their flame by making sure they understand the difference that they make in their work for patients every day. So a few years ago, to kind of like, we hoped this would like catch fire, we created a video about it, and we looked at our patient experience comments. We pulled out ones that felt like they had a lot of meat to the story, but it wasn't quite all spelled out there. We reached out to those patients and asked if they wanted to help us in recognizing a few of our caregivers, and asked them if they would like to write a letter to those individuals that they had named specifically in their comments. And of course, they were all like, yes, I would love to. And so we took these letters and we made up some reason for us to meet with these caregivers, and asked for their permission to record them reading a letter from a patient. Once we got there, we told them what it was actually all about. And it was so emotional. That video is now used in our new employee orientation, and we have gotten such positive feedback about how that captures why they went into healthcare, to see the reactions of those people as they read those letters. One physician read it, and he was just so emotional, and he said, I didn't know I made this difference and that I mattered so much to people. And that's what we want everyone to walk away with, by connecting them to their purpose and their passion, and help them remember why they went into healthcare.
I love that.
Thank you.
You get to draw a tear as well. What'd you get? Ooh, good hoodie. Yeah, I like that one. We still got backpacks and down jackets. Someone from Hawaii in here, I think it was over there.
Wayne.
We got a down jacket if you need it.
Yeah, you're going to Park City. You're going to need something warmer than that shirt. We'll have a couple questions in a minute, but I love those, especially you see the impact that happens. It really shows us why recognition matters. Brett, you're going to talk to us a little bit more about that, right?
I just love that you've all come here today. We're here at Recognition Summit. All of you know why recognition matters, and it's been so fun to go through each of these presentations and just hear all of these wonderful stories and how recognition truly does change lives and it affects people. And so me and Chelsea love our job on the product team. We get to hear all of your problems that you have in doing things, and we get to come up with solutions. And I just love that I'm able to make a difference because I'm helping these patients and caregivers get these recognitions. So just going over why recognitions matter, we know that simple acts can change lives. Sometimes you read a recognition that someone else got, and you think, well, there's nothing grand there. But for that person, sometimes it changes their life. And it really, just like the story you shared, it really makes them go through every single day and care so much more because of one positive recognition. And we know that recognized employees are engaged employees. And engagement is something that we know you admins are very concerned with. And as we keep employees engaged, we keep them at our organizations, and we keep the healthcare and the things we provide even better. And also, recognitions help us to focus on all of the good in the world. Madeline kind of touched on just how much negativity there is. And as we focus on recognition and as we get our workforce to do the same, we look to the good in each other and we look to the good in the world. And that really makes a difference. So we wanted to do another little breakout. We've heard a couple examples from you, but we're curious. You have your little survey, and you'll notice this is one of the questions on the survey. We as a product team would love to hear, what are you currently doing to gather these patient recognitions and to get them to caregivers? And we also want to invite you to discuss in your groups, and then we'll circle it back.
Let's do some raises of hands. Does anybody not have a way for their patients to recognize caregivers or those at your facilities? No, that's great. So you guys obviously know the value of recognition. That's why we're here. It's great that you guys have that outlet. I heard some murmurings. How many of you have a process that you feel is manual or tedious? Okay, yep, pain points there. But you guys are still doing it, which is really commendable because you know that that recognition means a lot. I heard some commonalities. I was actually recently at an IHC hospital for my mom for surgery, and in that stay, I think I saw 4 or 5 different posters for nominate someone for a Daisy Award. And then in her pre-op and her post-op rooms, there was even, hey, if you want to recognize your nurses or your caregivers today, this is how you do it. So you guys are advertising it. Does anybody want to share unique ways or ways that are really effective to get this feedback, to get these recognitions? Dylan has his fun cube. We've got some.
And more swag.
And some more swag.
It's lined up.
Oh, volunteers? If you're okay being on the spot.
There's the key.
Thanks.
It's nice
Patty
and squishy.
Wagner, BJC Healthcare. Oh, that's creepy.
You can tell Ryan to go away if you want. It's fine.
We've heard a lot of people say Daisy Award, Daisy Award,
Yeah.
Daisy Award. We have a partner to our Daisy Award, which we call the Connect Award,
Oh, cool.
which is for our non-nursing team members. Think patient transport, food and nutrition, housekeeping, concierge services.
Mm-hmm.
Those team members that still make a huge difference but aren't in the medical field.
Exactly.
And it mirrors it in terms of if we give out 5 daisies at an HSO, we're giving out 5 Connect Awards. So it's that same balance, trying to kind of make sure that everyone feels recognized. And our patients do that through, we have a flyer that goes in their inpatient paperwork. We have a flyer, we have signage on their screens within their rooms. All of our rooms are equipped with either an iPad or within their television. There's a QR code there, and then of course the paper, because there are still patients that prefer paper. The harder part that we have, which I would love your ideas on, is I use myself as an example. My son has a heart condition, and he spent 20 days in the CICU. One day, he literally had 3 nurses named Maddie on the same day. His nurse, the nurse next door who covered for our lunch, and then the nurse that he had that night.
Fun.
That's the hardest part for us as an organization, is when you get large and you have multiple people with the same name on the same floor and you don't put last names on a badge. How do you get the recognition to them?
Yep. That's definitely, you're not unique in that challenge. That is definitely a challenge that we've heard. So it's something we want to address. Thank you so much for sharing. And to reiterate off of that and Madeline's example earlier, recognition is, Dylan, let her have what she wants.
The thing is I didn't give the first 2 people what they wanted. So
Okay.
I'm just like, anyways, now you can look at, I don't know, I say children.
Oh, if you have any complaints, I'll let you know where Dylan lives. We can go visit him later.
Pages, I don't care.
Yes. But no, I love that story because we're highlighting those that aren't in our medical staff. You shared so many recognitions to someone just in the cafeteria. And, personally, whenever I take my mom to the hospital or anything like that, I always go check out the cafeteria or I wander around in the gift shop. And some of those people are the nicest people. And when you're sitting there waiting to know if surgery's gone well or if you're doing anything else, it just is so nice to see a friendly face. Any other stories, though, that you want to share? Any ways that you're gathering this recognition? Yeah, Matt.
So we've recently done this.
Oh, cube.
Oh, geez. So at Guthrie, we've really recently just done this because our CEO and leadership really wanted a better way for our patients to recognize our caregivers versus the paper forms that we were doing in the past. So one of the things that we did was really look to do like a web-based application where they could come on and submit the recognition for the caregiver that provided them service. We originally did this through a program with our Healing Hands, Grateful Heart. It's more for resource development to actually focus on, whatever funds we want, donated. But there's a lot of folks that, they went to the hospital, like, I already donated my money to the hospital system, but I do want to recognize this caregiver that really helped me during my stay. Yeah. And we have little QR codes, some marketing materials that go around to the different areas. Patients can scan it. It's handed out. Hey, if you had a great experience, go here. And we've recently just started this. It's been on live on our organizational site for about 2 weeks, and we have 8 recognitions that I'm uploading in. Created a form, Healing Hands, Grateful Heart, and now we can share that instead of with just a unit. Everybody in the organization can see that, and then it just shows the excellent care that isn't happening everywhere within our organization. So excited to see that. And then also with Jennifer, she was saying that their organization has like awards that are based on the different like number of recognitions, things of that nature. So looking to potentially integrate that as well. So it's a manual process right now. So anything, kind of doing that with, I know what you're looking to do is, can we streamline this to make it easier? So I appreciate any effort there.
Thanks.
Thanks, man.
Well, Wayne's ready for that down jacket. But I love hearing also like that you're trying to digitalize this and come into the digital age too, because my friend Jessica, she got that paper, which is great. She took a screenshot of it, but if she loses it, then she doesn't have that to reference. So I love the concept of having things digital in one place. But
right.
yeah,
So mine's more of a question than an example. But similar to what was mentioned over on the other table, when we were talking, Banner has a great recognition program, appreciation stations where people can write the forms.
Yeah.
Do you have any clients that have managed to? I love your QR code concept. It's even in the restrooms and then the soda stations. I mean, you have QR codes to basically give feedback and anything like that. Does anyone use the QR codes to directly load stuff into the Awardco product from a patient feedback?
So recognition directly from patients into the Awardco?
Right, because that would be what I would be interested in doing, and is it even possible with the product?
You could just come up here and present, because that's what we're talking about.
Sorry.
Brett, go ahead for it.
No,
Let me switch
that
it.
is the perfect segue. So me and Chelsea meet with admins all the time, and we're always looking for ways to improve your experience. And we've noticed that this is a very manual process, and yet it's something so impactful. So I love you segue into this. So our CEO, Steve, says Awardco is where all the good lives. And we really embody that in product, and we've thought, how can it be where all the good lives? Do you want to click next?
Yes.
And so, so we know that Awardco does peer-to-peer recognitions. We have manager-to-peer, leader-to-peer recognitions. Me and Chelsea are both over automated awards, so we know a lot about how impactful service awards and birthdays and onboarding your first day can be. But we know that we're missing this patient to caregiver. If someone's not in the platform, historically it's been very difficult to get that information in and to make that connection. Making that connection is the hard part. The patient's here, the caregiver's here, and then bridging that gap. And so we are at the start of our journey of getting external recognitions going. That's what we're calling it. And it is to help patients get the recognition to a caregiver. And so what we want to do is we're going to run through a little demo, and we want to show all of you currently what exists right now in our system. And then we're going to talk about the things that our team is actively working on to make this manual process a wonderful experience for everyone.
Flip to the next one. So this is where you get to participate. We're talking about QR codes, so go to the next one. Get your phones out. So you're going to act, this is what your patients would see. So scan this QR code. This is going to link into our Awardco platform. So we're hoping that, one, you can look at this form. It's completely customizable. Here's a screenshot of it if you are waiting for it to load. You guys can add in descriptions. You can ask whatever questions you need to ask. But the hope is with this demonstration is that you'll recognize one of our Awardco employees. If you're an existing client, that could be your account executive, your implementation rep, or your CSM. If you're not one of our clients yet, feel free to recognize somebody that you've met today. It could be Dylan for the great job he's doing working that cube back there. It could be Paige for setting it up. It could be Steve, our CEO, thanks for letting us come on site. So we want you to take this opportunity, submit a recognition if you feel like this link is going to be live. So if you want to wait and write something up later tonight or tomorrow, you can do so as well. You can access it. But go ahead, submit some in, and then we'll go through and see what it's actually like in the platform, what it'll be like from an administrative side. So a couple minutes there. Thank you. Okay, it's a little hard to see. The projector doesn't like us. But I'm seeing recognitions come in already. So all of our recognitions will go through a review process. That way we are catching anything that may be negative, or if there's anything we need to de-identify, we can look at this. But let's see. Looks like Estelle is getting one. So let's make sure we can add Estelle to this. Looks like this one came from Madeline. I knew that. Thank you, Madeline. So we're just gonna attach her name to it. We're gonna approve that. Estelle's getting an email right now letting her know that that was there. Looks like we've got one for Paige as well. I'm guessing this is our Paige Bennett. We have a couple also. Oh, from Lori, thank you. And so you'll see that we asked a couple questions. We asked what your name is, asked what company you're with, just so we can help identify these a little bit. But you can ask these types of questions. It's like, okay, we had 3 nurses named Maddie. Maybe we can ask additional questions to help identify those people. Lots for Paige. We love Paige. Great one for Mason. And I'm going to go through and approve all of these later on, too. So don't you worry. I will make sure everybody gets these. But I just wanted to show you a few, what it's like. And the administration is so easy here. We're looking at ways to make this even better for you as well. So they're all getting emails for this. Let's take a look at the feed. I'm gonna refresh here. So we're seeing it's on our feed. It's going to our Slacks. Everybody can see these and give emojis. So it's really fun. It's really simple, super integrated. And our main goal behind this is, if it's not easy, your patients aren't going to do this. And I saw how quickly all of those recognitions came in. I think the hardest time was just loading the site and making sure the internet works, right? And so that's our hope here, is that it's simple, it's easy, and your patients have a good experience. But ultimately, our hope is that your caregivers, those that you work with, feel recognized, because oftentimes the recognition that they need is not from another coworker. Great, it's good feedback, but you're working one-on-one with patients every day, and those patients can either make or break your day. So just having a difficult patient that goes in and then recognizes you means the world. Christian, let's switch back to the presentation if we can. And we'll go through and review some of these later on as well. We're running out of time, or I would do more. So, very simple. I alluded to there's going to be more we want to do this. Make sure there's less administrative costs for you. You look like you have a question. No? Thinking.
Are we in beta with that, or is that?
Yes, thank you. So this is currently in beta with us right now. Because you're here, this is something that we could sit down and have a conversation about and get it up for your organizations. On that little form that we passed out, feel free to jot down some notes, mark down that you want to meet with us. We're happy to sit down one-on-one and go in depth with this more with you. We are in beta, but it's a very good working beta. There's a couple things. Brett, let's talk about what to look for into the future.
Yeah, so looking into the future, you brought up a great comment. There was 3, I think it was Maddie's that worked for your son. So we took that problem to our product team, and we did a bunch of whiteboard sessions, put Post-it notes everywhere, exactly what you think UX does. And our first idea, the thing that we want to try, and what we're building right now, is an individual link. So what this does is, for every person that has a login in your system, they would get an individual QR code link. And they can put that anywhere. A badge, check out patient forms.
Yeah, in your intake or discharge forms, you could put those cute codes in there. Mm-hmm. Madeline gave us that idea, and I loved that.
And so what's wonderful about this is the patient doesn't even have to know the name, because they scan it and it takes them right to a form that is specifically tailored to that person. And so then even when it gets to the approval process for the admins, it already has that person right there listed for them. So that is something that we're working on. And then we're also working on making the QR codes based on group, or maybe based on the floor or what hospital it is, so that they can have a little bit of a narrowed down list after they scan that QR code, and not have 40,000 employees. That would be a poor experience for all around. Another thing that we're working on is embedding this form into your existing workflows. So for example, a lot of you have patient experience surveys. And what we're able to do is in that patient experience survey, we can take the responses from some of those questions that directly deal with a recognition, and we can feed them into that approval page that you've just seen. We're doing this currently with our CSMs. After you get implemented, all of you are aware you get to fill out a nice survey, and the last question is asking about the person that helped you, your CSM. And we have those from Qualtrics piping right in, and those are going onto the feed daily. Another way that you can embed the form is on your home pages or websites that you already have. And then the other things that we're looking into is how we can utilize AI. We know that at scale, we're going to get a lot of responses back, some positive, some potentially negative. And so we want to mitigate that burden of having to read all the positive and negative and you being kind of the filter. And we're wanting to leverage some AI there so that we can more auto-approve the things that we already know are good. And so if a patient scans a QR code right as a nurse leaves, the nurse might not even be to their car and have just gotten a recognition and text message that, hey, this patient just said this about you. So these are the things coming up, but we're also really excited that you're all here. If this excites you and you're like, hey, I've got some more ideas, I think I have some other things that would be really cool for this, we want to meet with you because we are actively building this product and we're actively wanting to make it as best as possible for the patients, caregivers, and for all of you. So my plea is that you join us in recognizing the good in the world. I thank you all for being here. We know that because you're here, you love recognition, and there's a lot to do. And whether you choose to use Awardco or not, we believe that every recognition is a good recognition. And so we want people to see the good in the world. Thank you.
Thanks, everyone.